Thank everyone for coming to our program today, PTSD Symptoms and Treatment with Dr. Scott. I'm Laurel Westendorf. I'm part of the Community Relations team at the Deschutes Public Library. Every month we celebrate every year we celebrate our community reading program, A Novel Idea. This is our 18th year. And today's program is part of our exploration of this year's book, The Other Americans by Laila Lalami. Since several of the characters in the book have symptoms of PTSD. And this event today, this program is made possible by our sponsors and is supported by you. Thank you. Our presenter, Dr. Scott, is a postdoctoral fellow at StrongStar, the South Texas Research Organizational Network guiding studies on trauma and resilience. She provides evidence-based PTSD treatment to active duty soldiers, veterans, and military family. And she supports veteran health research and provides consultation services to behavioral health providers for prolonged exposure therapy. Dr. Scott earned her Ph.D. in clinical psychology and industrial organizational psychology, and she served in the U.S. Army as a captain in the Medical Service Corps. Thank you so much, Dr. Scott, for talking with us today and sharing your expertise on PTSD and today's treatment.
Thank you. I'm really happy to be here. Thanks for inviting me. And I just am happy to share some of my thoughts concerning PTSD. Let's go ahead and get started. I'm going to go ahead and share my screen. And so we're going to be discussing The Other Americans, which is a book that we've all read. But more specifically, I'm going to be focusing on understanding common reactions to PTSD and building empathy within that space. I'd like to go over our agenda just very briefly. I know that there's probably varying levels of understanding as it relates to post-traumatic stress disorder. So I'm not going to go overboard. I'm just going to give you a sort of a brief synopsis of what it means. And then we're going to go ahead and go into PTSD and its effects on the brain, and then talk about the types of trauma and also prevalence of PTSD. And then more specifically, how can PTSD impact relationships? And I'd like to talk to you about that from more of a systemic perspective. And then we're going to use the characters in the book to talk about how to build empathy as relates to individuals who might experience PTSD, more specifically through vulnerability, communication, accountability, and also exploring the role of culture in trauma experiences. So what is PTSD? So PTSD is an exposure to actual or threatened death, serious injury, or sexual violence in one or more of the following areas. So directly experiencing a traumatic event, witnessing the event in person as it occurred to others, or learning that a traumatic event occurs to a close family member or friend. And in this context, it must have been something that is violent or even accidental, and then experiencing extreme or repeated exposure to adversive details of traumatic events. And some of the symptoms of PTSD include intrusive thoughts, irritability. So a patient might report that they're having issues regulating their emotion. They might report that they're having some anger outbursts at work, things like that. They might also report having some disruptive sleep patterns. So oftentimes they might say they're having issues getting to sleep or even staying asleep. It's something that's very commonly reported in treatment. And then also mental or physical distress to trauma-related cues. So they might say, my heart is racing faster when I'm reminded of my trauma experience, or I feel like my mind is racing, or I feel like I'm sweating whenever I'm reminded of my trauma experience. That's a very typical response of an individual who might be exhibiting some PTSD symptoms. In addition to that, there might be some attempts to avoid trauma-related cues, for example, places, persons, or objects, things that might remind a person of that trauma experience. So a good example might be a soldier who has some combat-related trauma, and they might have been on their way to in a convoy. And during that time, maybe there was an IED explosion, and maybe their TC or maybe their gunner or a driver was eating maybe a piece of fruit, let's say an orange, right? And from that time on, that person might have an aversion to smelling an orange or any type of citrus fruit because it triggers that memory. They might not even want to go down the produce aisle or the fruit aisle or anything like that. So pretty significant avoidance takes place when a person is experiencing PTSD. And also alterations in the way a person might think and feel. We call these things maladaptive cognitions. And so oftentimes your patient might say, or a person that you know that might experience PTSD might say, I could have done something different. I wish I would have done something different. I should have done this. It's my fault. Or they might blame themselves or think the world is completely dangerous now because of what they've experienced. And they might also experience an increase in fight or flight response. That defensiveness, what we call is hypervigilance, always feeling like they have to be on guard and ready for something to happen. And so the three core symptoms really of PTSD and what really drives avoidance is intrusions, arousal, and cognitive emotions, which really significantly contribute to maintaining PTSD and also gets in the way of recovery of PTSD. From avoidance, you'll notice a person might exhibit some aggression, some self-harm behaviors, even some substance abuse issues or binging or cognitive avoidance or even behavioral avoidance. Some emotional numbing, feeling very detached from family, from friends, and also social withdrawal or a behavioral inhibition. So that person might experience themselves engaging in things that are more riskier than they would before. Oftentimes they are met with infidelity, or maybe they speed, or they just engage in more reckless activities. And that is very typical of someone who might experience PTSD. Let's talk a little bit about the effect as it relates to PTSD. And so the brain is really complex, and we can get into the weeds of things, but let's keep it pretty brief and let's just go over an overview of the main functionings of the brain. And then we're going to compare a typically developing brain to a PTSD brain. So while you see normal brain, I like to think of it as a typically developing brain. I think that's a better word for it. So if we look at the structure here, the prefrontal cortex, it has to do with complex thinking and decision making and also appropriate behavior. But when you look at the PTSD brain, which is structurally different because of the trauma, right? There's a biologic component to it that's happening. It's dysfunctional thought processes and decision making. Oftentimes, it's inappropriate responses to situations. And then when we move to the hippocampus, we see in a typically developing brain, the transfers and stores information into memories, right? And that has to do with a person who has maybe OCD, but it's also appropriate for a person with PTSD because with their brain, where it stores memories, it's incorrect, and also it affects their memory retrieval. So oftentimes, when you have a soldier or even a patient and you're asking them about their trauma narrative, they might find it difficult to retrieve all of the information. They might say, it feels really choppy and there's just parts of it that I can't remember. And that in and of itself can feel very frustrating and even distressing for patients or a person with PTSD, especially if they've lost someone significant in their life as a result of the trauma. They might feel like they should be able to recall all of the events, but yet they struggle with all that information. And as we look at the hypothalamus for a typically developing brain, it has to do with releasing hormones like cortisol or adrenaline to help manage and direct efforts of the stressor. But for the PTSD brain, the key is that it becomes overactive, which leads to imbalances in hormone levels and increase in stress and anxiety. So those stress responses go all the way up as it becomes overactive. And in the amygdala, for a typically developing brain, it has to do with our fight, our flight, our freeze responses, really our survival. So if there's like an actual or perceived threat, we're able to respond appropriately. But in the PTSD brain, it sets off the fight or flight or freeze response, even when there's not an actual or perceived threat. It's only when it's related to a memory or any thoughts about danger. So that's a key part in terms of the typically developing brain and then someone who might have PTSD. Let's talk a little bit about types of trauma and prevalence. So 60% of the population has experienced at least one traumatic event in their lives, which is pretty significant. 7% of US adults develop PTSD, while 4% are males and 10% are females. And 14% are made up of US service members and veterans. And so that's just an important piece, I think, to consider when we're thinking about data as it relates to who might be experiencing PTSD and what that prevalence could look like. It is also important to note that the rate of PTSD development is influenced by the type of trauma one experiences. So for this slide, the blue bar is going to illustrate trauma exposure by type of trauma, and you can see that listed there. And the white bars are the percentage of who develops PTSD. And you can clearly see that combat trauma and rape traumas led to the most incidences of PTSD. You might ask yourself, why might that be? For some reasons, for some individuals, they might internalize that experience as individuals. And what that basically means is that they might begin to blame themselves for what happened and feel like in some ways they have contributed to their own trauma. And then as it relates to combat traumas, we're learning more and more every day about that. And we're learning about trauma exposure and the rates of PTSD as it relates to cumulative exposures and also blasts and trauma brain injuries. And so that really can help us understand the prevalence in combat trauma. Okay. And let's talk a little bit about how PTSD can impact relationships in the following areas. Because I work with families with PTSD and I work with soldiers with PTSD and also patients or veterans, I like to look at PTSD from a systemic perspective. And so there's a lot of things that can affect sort of the relationships when a person's experiencing PTSD. But here's some things that really jump out at me that I really come into contact with frequently. And one of the things is communication. I often experience a couple or family coming in and saying, this is the last stop before we dissolve this relationship. This person may be a patient or a family member or a soldier is not communicating very well with me. I don't know what's going on. All I know is I'm experiencing them as an angry person. They're having outbursts. They're not communicating at all. And I can't really understand the changes because that communication is not open. Okay. And then when we talk about vulnerability, we see that there's an increase in that because, of course, the person who's experienced PTSD, they don't want to open themselves up the same way. It's their way of trying to protect themselves. So they might not disclose information. They might sort of be numb or create this separation. And so oftentimes that vulnerability is just not there and they're not willing to disclose why. Okay. And then for co-parenting, we see that for military families, a lot of it has to do with being away from family members and then coming back and trying to reintegrate and really struggling with that. But for other individuals who might experience other types of PTSD, it could just be not really feeling like they're connected in that experience or really engaged in the way that they would want to. And so that becomes an issue and significant challenges for families. In terms of connection with family members and children, this extends past the immediate family. I would say it can also extend to the other family members as well, because a family member might not feel like, they want to share that they're struggling with PTSD. If they're having issues with sleep patterns, they might not want to go on a visit if they have nightmares, because then they're opening themselves up for someone to understand that they're struggling in that way. And that in and of itself can create an isolation around the family and also the individual. And also it helps to perpetuate the stigma that's associated with behavioral health issues in general. Intimacy relates to sort of sexual relationships, but not only that, it relates to just partnerships, right? Being able to connect with your partner, be curious about them, and understand sort of what's happening with them and how they're developing. When a person's experiencing PTSD, they might struggle to connect in that way. They might experience, again, this emotional numbness and emotional disconnectedness from their partner. Even if they want to experience very positive emotions, they might find it very difficult to be able to sort of display that. And so they may struggle in that area pretty significantly. And when we talk about socialization, that really relates to the things that that person might have, done in the past that they used to enjoy that they're not doing anymore. It could do with their interest to meet new people and reluctance to engage in activities where other people are going to be invited. It could be something as simple as taking their family out to dinner. They just might not feel comfortable in those environments and actually might really experience significant distress. So in terms of socialization, PTSD can really be harmful. Now let's discuss empathy, but I want to discuss it within the context of the characters of the book because I thought the author did a great job of really creating this realistic framework around the complexities of PTSD. And so I want to sort of draw from that. And so the first person I'd like to discuss is Fierro, who we learned was had experienced some combat-related trauma. He was injured in combat and Jeremy was his battle buddy. Upon redeployment, Fierro continued to struggle pretty significantly, I would say, with PTSD symptoms. And Jeremy demonstrated empathy by holding Fierro accountable and encouraging him to seek behavioral health treatment. So in sum, he was saying to him, I support you. I understand that you've experienced something that's very difficult, but it's also your responsibility to seek the treatment that you need. And so he did provide a level of empathy through this accountability, which I thought was really nice in terms of how the author illustrated that. And then we talk about Jeremy with, he also experienced combat-related trauma as well. He was injured in combat, but also he had a history of childhood trauma. And so for us, I would consider that complex trauma. And what that means is a person coming into your office for one thing, and after understanding that they have a childhood history or some other history of trauma, it becomes more complex trauma. That means that they just had more than one experience of trauma. He struggled with sleep disturbances throughout the novel and also had some emotional regulation issues. However, he became a police officer and relatively stable. He was able to make good choices and have a career for himself. And as the book progressed, he reconnected with Nora, and she demonstrated empathy towards Jeremy when he began to disclose certain things about his past, when they reflected on his childhood, and also when he got to the point where he felt safe enough to discuss certain things related to his combat trauma. And so that also was a good display of empathy as it relates to communication and also building vulnerability within a relationship. The next person I want to discuss is Efren, who, if you recall, when we were talking about the criterion for PTSD, one of which is witnessing a traumatic event in person, and that's something that happened to him. Efren witnessed Driss's death and subsequently experienced post-traumatic stress symptoms. I wouldn't say PTSD because he didn't meet criteria for all of those things, but who knows how it would progress. He did share the fact that he witnessed a hit and run with his wife, but he didn't share the distressing symptoms as they progressed. He didn't share the intrusive thoughts and the avoidance. And I wonder if Efren would have chosen to share those thoughts and feelings with his wife if it may have led to an increase in their own connection, their own intimacy, and vulnerability in their relationship. But what's also important to consider within this context is culture, right? And the role that culture might play as it relates to PTSD symptoms and how one might experience it. So as a therapist or someone who might be engaged in someone who has a different cultural framework, it's important to have informed curiosity and asking really important questions about how they might experience PTSD. And I think Efren is a really good representation of that. And finally, let's talk a little bit about Nora, who experienced some racial trauma. She and her family, they endured some discrimination because of their cultural and ethnic background. As such, Nora exhibited symptoms of hypervigilance. There was a lot of defensiveness at different times in the book, some distrust, and also some avoidance of people and places that reminded her of past racial trauma experiences. Like if we think about the distress that she experienced in the bowling alley, really being uncomfortable with that and sitting in that space. She also demonstrated vulnerability with Jeremy when she was disclosing specific experiences as it related to some of her racial trauma experiences. And also, what was really important, I want to highlight this, is that Jeremy demonstrated this supportive level of empathy. He validated Nora's experiences. He did not attempt to reframe her reality as it is different and separate from hers. And I think that's such an important piece as we talk about racial trauma and we talk about cultural frameworks, is to understand that there are differences, right? And so it's important to validate others' experiences and create spaces for them to be able to feel safe enough to disclose and not attempt to sort of restructure their reality as it might be different from your experiences. And I don't have anything more to say. I was really hoping to have this conversation or have it be interactive. So the next thing that I want to do is open it up for questions. And if you have any, I'm happy to answer.
I loved how you flowed back into the actual characters, because it just helps to see an example from what we've read about these characters. And I did notice, Nora had I appreciate you bringing up the racial trauma that she experienced, because she had a very antagonistic relationship with her white passing sister. They had entirely different life experiences and moved through the world in very different ways. And so it didn't seem like Selma had as much of those racial traumas, but she only had one chapter. So,
right. Very true.
Do you think PTSD, or how do you think PTSD is oversimplified in our culture?
I think that's the reason why I sort of wanted to provide the data. I think that sometimes we think it's so pervasive, it happens all the time, the prevalence of it, and really not so much. And so I think that's one thing in terms of debunking the myth that everyone has, PTSD, or combat veterans, all of them have PTSD. And that's just not true. I think that the complexity of understanding it has to do with sort of the way in which we think about ourselves, really from a medical perspective. For some reason, we tend to think of ourselves from the neck down and not really considering the role of the brain. And I don't know why that is, but there's a very biological aspect of PTSD, right? That means that if you looked at a person's brain prior to any trauma and then after, it would look structurally very different. And I think that's fascinating and important to know. And even the brain structures perform differently, as we discussed briefly in this presentation. And so I think there's just so much to learn about it. And it is pretty complex as relates to many aspects of our overall functioning. I think it's just trying to figure out, and we're finding out more information. And so maybe that has something to do with it as well.
I was wondering when you were showing the brain, how much you could actually see physically. And so you can physically see the brain changing from PTSD.
It's very different, absolutely. And if you look at, we're getting sort of in the weeds, which I love. If we look at the fMRI, it looks very different in terms of like the connectivity and how things are sort of functioning too. So it's very fascinating.
And yeah, does anyone else have a question? We have some participants here. That was great, Frankie. I thought that was great. Oh, here's one. Is there a way to retrain the brain out of the PTSD style?
Yeah, there's a couple of ways. One of which is evidence-based practice, and that's something that I do. And we really focus on a lot of data, right? That's based on outcomes, many different sample sizes, and we look and we do this manualized treatment for PTSD to see what the outcomes might be. And what we found is the gold standard treatments for right now, as it relates to at least the Department of Defense, is cognitive processing therapy, CPT, or prolonged exposure therapy. And to that person's question, CPT really focuses on challenging those maladaptive cognitions around trauma, right? I could have done something different, or why am I here and they're not here? This is not fair. I blame myself. I could have, dressed differently. Whatever the cognitions might be, that's not helping you really fully understand sort of what's happened and accept the trauma, so that you can move forward. That's what we work on in terms of retraining the brain and challenging those thoughts. And that's a part of the work that we do in cognitive processing therapy and through prolonged exposure therapy as well. And then there's some fundamental things that you do around like memory, because oftentimes a person might struggle with PTSD and might have some issues with memory. So there's things that we can do with that, and they can do a different sleep protocol as well. So there's many different ways in which we can address these symptoms.
How has PTSD treatment changed over time? And, what you're talking about, is this all relatively recent?
I think for many years, there's been a lot of work around PTSD. I think for me, at least in my sort of foxhole, because of the work that I do, a lot of the work has been around combat trauma. I think really understanding the difference of combat related trauma as it relates to other types of trauma, right? Because oftentimes there might be trauma brain injuries involved, a blast involved, which can completely sort of affect this person's overall functioning in multiple areas. And so I think a lot of the research as of late has really focused on that in a really beneficial way. It's really helped us understand the roles and the different types of traumas that can occur and how they're really manifested.
And you mentioned to me before the program that you really enjoyed this book and you thought it was a very accurate representation of PTSD.
I do.
And I really,
I do.
And I really appreciate how you explain the complexity of the many different characters that have different PTSD.
Right. And for some, they didn't have PTSD, but they certainly demonstrated, like Efren, certainly demonstrated, and even I would say Nora to an extent demonstrated some post-traumatic stress symptoms. And so I think that's also important, because it doesn't mean that it's the development of PTSD, but who knows what could happen over time if it's untreated.
Thank you so much for your insight into this, and especially for looking at the book. Do you know of any written material or books that you would recommend for people looking for more resources on PTSD?
Yes, I would recommend the Cognitive Processing Therapy manual for PTSD, and also Prolonged Exposure manual, which I can send you. I can email it to you if you want to send that out for sure. That's a great resource. And then there's also just different books that you can read that's less clinical. Those books are pretty clinical heavy, but just in terms of understanding how the body, the biological aspect, the behavioral aspect, and the cognitive aspect of PTSD, how it affects our body and our functioning. a really good book is The Body Keeps the Score. I don't know if you're familiar with that book, but that's a really good book around trauma and how it can affect our overall presentation over time.
Well, thank you so much for taking something very complex and giving us the lay of the land with that.
Sure. It's been great. Thank you for having me.
Yeah, absolutely. And for those of you in the audience, thank you so much for joining us. If you want to see more programs to celebrate our novel idea read, you can go to DeschutesLibrary.org/novel idea. And all of our recordings will be up on YouTube as well, including this one. So have a wonderful rest of your afternoon, and thank you.
Thank you. Bye-bye.